So, hello, everybody, and welcome to a Friday class. My name is Mapuana Mergel. I live in California. I am a wife, a mother, a lover of all things natural, a dog mama, and that's how I take care of my family with doTERRA. As far as our health is concerned, outside of my home, I serve my community as a medical massage therapist and a certified labor doula. And I use doTERRA in those businesses as well to help people with all types of health concerns, whether it be digestive issues, pain management, mood management, and all of the above. Welcome, Mary. We see you joining there. Thank you so much for coming back. Last week, we took a break because it was July 4th weekend, right? So I hope everybody had a little bit of a good time and was able to enjoy the weather and the family and some time off of work. I know I did. But we are back this week at 3 o'clock for just 30 minutes, talking about all things doTERRA and how to create a healthy lifestyle with doTERRA essential oils and supplements. Okay. So I usually record our classes and you can rewatch it or share it through my YouTube channel. If you just Google my first name or type in my first name, Mapuana, my channel will come up. Go ahead and subscribe to that and watch all the other classes that we have had here. I love it when people use the chat feature. So you could drop comments, questions. Some of us will be able to answer those if I don't get to it in our presentations. Okay. You could also drop doTERRA oils and supplements that help you with this particular issue that we're going to be talking about. So my invitation was entitled Reflex Remedies, right? And so we're specifically going to kind of target acid reflux. So getting a case of acid reflux or heartburn once in a while isn't unusual. Most people have experienced it once or twice in their life, right? But some people suffer from this burning discomfort and bloating and belching almost every time that they eat. And it is stated that about 20% of the population has GERD. Anybody heard of that? GERD? That's gastroesophageal reflux disease. So it's a chronic acid reflux condition that's actually diagnosed by a doctor, right? So acid reflux is a symptom of the more chronic disease called GERD. Now, normally the esophageal sphincter, which is a muscular tube that lets food pass into the stomach, and then it cinches shut to block it from coming back up. This protects the esophagus from the stomach acid. Okay. Now, if the sphincter relaxes, food can push upward through the loosened opening and cause acid reflux. So it's acid from your stomach coming back up. Okay. So I'm going to share my screen and actually give you a visual. And what I'd like you to do is take your right hand and actually place it right underneath your rib cage on the left-hand side, okay? Because that means you're going to be touching your stomach. Your stomach lies on the left-hand side, okay? So let me bring up the picture. Jennifer, can you see this?
You sure can.
Okay, thank you. So you'll see a healthy stomach, and the yellow on the bottom is the acid, right? And then you'll see the esophagus coming down into it, and that sphincter closed. Okay, so keeps the acid in the stomach. When you have acid reflux, okay, on the right-hand side, that's what a GERD stomach looks like. That sphincter is open and it allows the acid to come upward, okay? So as you're touching your stomach, just know that that's what's taking place. That's where it happens. And that's where you could actually apply doTERRA essential oils to help with this particular health concern. So again, acid reflux is a symptom of GERD, just like bloating is a symptom of IBS, right? Acid reflux is occasional, where GERD is constant and has even more serious symptoms than just burning or heartburn. So obviously, food can definitely aggravate it, right? So you got to know your triggers. You have to pay attention to your body when you eat certain things. But stress can also trigger acid reflux. A hiatal hernia, you may know pregnant people that have suffered with it for the first time in their lives, and that makes sense, right? Because the baby is pushing up on the stomach. And even abdominal weight can trigger acid reflux. So you need to know what triggers an episode, which requires a little bit of lifestyle change, a little bit of slowing down, a little bit more paying attention, right? We know that diets play a major role in controlling acid reflux symptoms and usually is the first line of therapy and topic that doctors will discuss with patients who go see them for this issue. So, again, you must be aware of your triggers. I'm going to open it up right now. Feel free to unmute yourself as I ask the question, what do you think are some typical foods to avoid if you suffer from acid reflux? Go ahead. What do you guys think?
Spicy foods.
Yep. Spicy foods. Anybody else?
Greasy.
Yeah, those
Mhm.
with the high fat.
High fat, fried foods, pizza, cheese. It's going to be different for everybody, right? Tomatoes, chocolate, uh, carbonated drinks. That's really hard for some people to give up, right? But it actually might be all about moderation, not actually eliminating it. For some of us, we can just have a little bit and it be okay, right? But definitely try to avoid eating your problem trigger foods late in the evening, closer to bedtime, so that you're not sitting, so it's not sitting in your stomach and then coming up your esophagus when you lie down to go to bed. And that makes sense, right? Now, it's also a good idea to eat small, frequent meals instead of bigger, heavier meals and avoid late night bedtime snacks. Sometimes we get a little hungry and we want a little something, but that's not always good for us if we suffer from acid reflux. Now let's mention a few doTERRA products that can definitely help prevent and manage symptoms when they arise. Of course, I know everybody's thinking about the first oil, right? Digest Zen. This oil is fast acting and can be used all three ways when an episode starts. So you could put some in your mouth, under your tongue. You can simply smell it, and you could put some on your chest, all over your stomach, above and below your belly button. You will feel a shift, a change, and something taking place within seconds of using this particular oil. And personally, I don't get acid reflux a lot. I think I have had it about 3 to 4 times in my life. But I have found that it is most effective to smell this oil or to take it in internally with an open mouth. So just like I do the Breathe balm for my asthma, I do the same thing with Digest Zen when I'm having an acid reflux attack. Because there's all this tingling that takes place in your mouth and it stimulates your digestive system right away. So instead of smelling it with your nose, you just take it in with your mouth like an inhaler. Okay. Now there's also fennel, peppermint, ginger are also very helpful. Those three can be used in hot water, just a couple of drops with some warm water and honey. Sipping on that can really reduce and calm the digestive tract. It has been said that putting some of those oils, fennel, peppermint, or ginger on a warm washcloth and then placing it right over your stomach And sitting up straight and taking a few deep breaths can help rearrange things, help your body regulate, right? Then we have the Digest Zen tablets. Raise your hand if you use these things or if you have in the past. I have some customers that order these like 2 at a time and will never be out of stock. These Digest Zen tablets, they are only $18 per bottle. They come with 100 tablets in it, and they could replace any antacid. So think Tums, Rolaids, Alka-Seltzer, and this one's much more effective. Do we have anybody here who wants to share a personal testimony about this particular product? I saw some people raise their hand that they've used it before. Just go ahead and unmute yourself. Okay, so if not, then maybe at the ending you can share something if you want. Those are the first two products with those other oils that I mentioned that can help with this particular health concern, okay? Most of the times, doctors will also talk to you about lifestyle changes that can help. Improving your posture is a very simple thing to be aware of. A lot of times we're bent over looking at our phones or our computers. So we're bent over in the chest, the thoracic area, right? And then we're bent over in the waist and we're crunching everything below that. So sitting up straight while we eat, breathing more, being mindful of how your eating behavior is, chewing your food enough. I have one doctor who recommends putting your fork down in between each bite to make sure that you're not stuffing your mouth. Another suggestion they have is actually sitting down for a meal. Sometimes, because we live busy lifestyles, we stand up to eat. I know I do that a lot. I just stand at my kitchen counter and I eat. And before you know it, I'm like, oh, I'm done. I'm going to move on to the next thing, right? But those are little lifestyle changes that can be made. Also, elevating the bed while you're sleeping. If you have serious issues, you can sleep on a wedge. They don't recommend propping yourself up on a lot of pillows because that can change and shift your posture. So sleeping on a wedge is more effective. And finally, going for a stroll for just 10 to 15 minutes, maybe even out in your yard after you eat. You're causing the peristaltic action in your intestines to get activated, and the digestive system starts working better. Okay, any particular questions about those things that I mentioned already? Because I'm going to now share screen again. If you have any questions, go ahead and unmute yourself. If not, I hope you enjoy this short video from Dr. Artemis Morris. She is a naturopathic doctor in Connecticut. Oops, let me see if I can bring this video up. Okay, here we go. Share sound and optimize video clip. Well, they've rearranged a few things on Zoom. Okay, I hope this works right. This is called Kara's Cures, and you'll see her Instagram account at the end of the video in case you want to follow her, okay?
It is time now for Kara's Cure. So many of us deal with acid reflux, but there are certainly ways that you can help heal naturally.
Yeah, joining us now to talk more about the naturopathic physician, Dr. Artemis Morris. Nice to see you.
Great to see you guys again.
All right, could you first, I get it, but can you explain what acid reflux is and how we get it?
So that's kind of a trick question, actually, because acid reflux the symptoms of high acid could actually look like the same symptoms as low acid. So if you have acid regurgitation, or you have like kind of a feeling in your throat or your upper GI where you feel some kind of fullness or heaviness, that could be acid reflux. But one of the problems with proton pump inhibitor use is that sometimes you're being prescribed something that's for high stomach acid, but the real cause is actually low stomach acid. So that's part of the trick of heartburn. You definitely want to get an assessment to see which one is it. Because if it's high stomach acid, you might have the right medication, but if it's low, you might be on the wrong medication with a lot of side effects, especially long term.
Is there a test for that?
So, well, I didn't even know. I guess I had the silent version of it. I was getting laryngitis, and then when they scoped me, they could see that part of it was acid, and so they did want to put me on a PPI, which is the standard thing to do for a little bit. And I know a lot of people are doing this, and now it's becoming more mainstream with doctors of like, all right, we don't want you on this very long. We'll go on it for a little bit. But there are people who have been on them for years and are being told you can never come off of them. And you have concerns about that because you said sometimes the pills that that we're given for acid reflux or heartburn, all that stuff, could cause more harm than good over the long term.
Yes, this class of medication called proton pump inhibitors, Prilosec, omeprazole, it is the most widely prescribed medication in the US and possibly worldwide. And it is one of the most dangerous possibly worldwide as well, because the side effects could include things like increased risk of infection, because your acid is your body's way of preventing infection. So we need some stomach acid. The problem is when we have too much or too little. And so the side effects can include 44% increased risk of bone fractures, according to one study, increased risk of Alzheimer's, dementia, increased risk of worse clinical outcomes with COVID even in a recent study, nutrient deficiencies, iron, magnesium, things, vitamin B12, very important nutrients for brain health. So the American Gastroenterology Association even came up with a study, a position on how to safely go on them and go off them. And long-term use is, really very not indicated for very many things. So there are many alternatives as well that we can talk about.
Yeah, I'm lying in bed. It's midnight. I have acid reflux. I can't get to sleep, but I don't want to take this pill. What naturally can I do?
Well, first of all, you want to elevate yourself. So sometimes very simple. It's, you want to really make sure you're not eating late at night and not laying down. So that's one thing. The other thing is there are foods you want to prevent yourself from eating, which are tough sometimes, is spicy foods, especially tomatoes. Native tomatoes are in season right now. Tomatoes. I know, I'm enjoying them. So you want to avoid spicy foods. And then also things like there's a tree, a native tree, slippery elm, and the indigenous people have been using the bark of that tree for centuries. And I use it in my clinical practice, in my integrative medical practice as well. Slippery elm bark tea, aloe vera. I have some aloe here, so that's one thing that's safe and effective. Anything that is soothing to your skin will be soothing to your GI system. And then there are also studies looking at some nutraceuticals that include something like DGL, deglycerinated licorice root. So licorice root tea can help. Also L-glutamine, which is food for your gut. And even melatonin. I know, Kara, we did a segment on melatonin a while back, and there are studies actually showing that melatonin can help also with reflux symptoms. But you want to get something specific, and even gum mastic. There's a lot of options we have. So check with your GI doc. But, 2/3 of people are on these medications, and it's not indicated for them to be on it. So it's a big problem.
Unfortunately, I had, I wanted to get my voice back quick. I was suffering from laryngitis, and the doctor totally understood. He's like, we're going to just do this short term, and just to turn it down real quick. And then I got off of it without too much trouble. But some people who have on it for months, there's a way to get off, and you help people do that. But some of the lifestyle things, not eating 3 hours before bed, even having a little apple cider vinegar before meals can help build that up so that you have less symptoms. Is that right?
Well, apple cider vinegar and vinegars are only indicated if your reflux symptoms are due to low stomach acid. So, you won't find out until you try it. Some people it's going to make it worse, some people better. So, you're better off doing something like slippery elm tea. Even gum mastic has some really great studies on it. So, L-glutamine. There are certain powders I have that have aloe L-glutamine in it, like glutalamine is one product in particular I use a lot. But you can effectively get off of it.
Yep.
But you may want to wean off of it because there's a rebound effect.
Okay.
Yeah, because you can get worse before you get better. We're going to talk about this more on WFSB Plus on Kara's Cures. You can also listen to the Kara's Cures podcast. I know a lot of people have been prescribed this medication, so we're going to get a little deeper into how to get off of it and why you might want to, and have this conversation with your doctor. And of course, you can also visit the ArtemisWellnessCenter.com or follow Dr. Artemis Morris on Instagram, and she can help you as well. Thanks, Doc.
Okay, so I hope you enjoyed that video. I really liked her Instagram and all of the things that she was talking about. I love the fact that she's a naturopathic doctor, and she mentioned some natural remedies, right? She obviously didn't mention doTERRA, but that's what we're here for. We want to remind each other of things like Tamer and the roller blend. Even children suffer from acid reflux sometimes. So Tamer could help them. Supermint is pretty powerful, right? Celery seed, cardamom, thyme, black pepper. I know people who have even used wild orange and zendecrine. So we have a lot of different oils and supplements that can help us with this issue. When you apply them above and below the belly button, even your chest, and then also trying to relax your body at the same time to give it time to adjust and self-regulate. Okay? Finally, we're going to consider if stress is causing acid reflux. We know and we realize here in the doTERRA community that stress is an important issue to address because it affects our health on many different levels, right? It is another factor yet in this topic of acid reflux. It is known, and there have been studies to prove that stress causes an excessive production of stomach acid, which can bring on an episode. A 2004 study published in the Psychosomatic Medicine looked at 60 participants who dealt with heartburn over the course of 10 months. And researchers found that severe, sustained life stress could significantly predict increased heartburn symptoms. So there is a connection to heartburn symptoms and exhaustion. And again, in this doTERRA community, we are aware of the importance of reducing stress and all of the benefits that can come from that as well, right? Even when it comes to heartburn. So use your oils before eating a meal and manage stress. And most likely it will help prime your digestive system to work properly and eliminate or definitely help you manage acid reflux. Now, wrapping it all up, there are many habits that can help eliminate or manage. And we have talked about some of the products that can help us. But my hope is that you turn to these products first before you turn to pharmaceuticals and drugs. I'm not saying don't go to your doctor and get help and find things out, but become your own advocate. And remember that doTERRA's products work. They're all natural. They're good for us, right? And so not only do I want you to use them for yourselves, but I want you to share them with other people because people are really looking for these types of answers. So that's almost our time. We're going to use the rest of our time for Q&A and testimonials, and then we shall wrap it up. Okay, now I close that, and I've got gallery view on, and I can see everybody. Okay, do you have questions, comments? What would you like to share about anything, Drea?
I just wondered, when you were reading off the products, what was that, Tamer?
Tamer is the children's roller blend. That's good for all types of digestive issues.
Is that spelled Tamer?
Correct.
Okay, and I got the Supermint, celery seed, cardamom, black pepper, and there were a couple more you mentioned.
So
I don't
thyme,
remember. Okay,
wild
okay,
orange, and even zendocrine.
okay.
So just like she said in the video, it's a trial and error, right? You may not like the smell of thyme. Some people can't handle the smell, but they want the benefit of it. So they just, use it anyways. Celery seed is pretty strong, but it works fast. So it depends on how bad your symptoms are. See, Dee is laughing because she knows. Super mint is pretty general. Most people can handle the mints, so you have to try them out. Terry, you had your hand up?
Basically you answered it with that list. That's what I was curious about. Now, I've done some reading that actually peppermint can irritate.
Yes, it could. It could for some people. So
Okay.
so some people could use it and it would help if they use it topically, but then if they put it inside their mouth, then it causes irritation.
Okay.
So there's a host of other things that you need to be watching for when you sample the oils and try to find which one works best for you,
Okay.
So, but we do have a lot to choose from.
Okay. Thank you.
You're welcome. Anybody else have any questions or comments? What do you guys think of the video?
Good.
Excellent.
I don't think this addresses Jerry's problem.
I hope you're able to follow her on Instagram or check out her website. And again, this class is going to be being recorded and it will be posted on my YouTube channel for you to review. So, okay, everybody, thank you so much for joining me on another Friday. I hope this information was valuable to you. I'll be here again next week, Friday at 3 o'clock for just a few minutes talking about the emotional freedom technique. So if you don't follow me on Instagram, try to do that. I am at dream_manifest_grow. And the emotional freedom technique is going to be a hands-on workshop where I'll walk you through a particular pattern of how to do it. And then we're going to add oils onto it, and it's going to be so much fun. Terry, you have a question?
Yeah, I have another one. Early on, if I got this right, you said that you could go to your name, Mapuara, on YouTube, and that's how we can follow you.
Let me put it in the chat. Mapuana. When you type that in the search bar of YouTube, then you'll find my channel. Okay?
All right. Thank you.
You're very welcome. All right, everybody. Thank you for joining me again. We're at our time limit. You have a great weekend, and we'll see you next week.